Okay, this isn't how I intended to do this, but I'm having trouble trying to transfer the PowerPoint onto the video, so I'm going to have to do it this way. So this is part 4 of Save a Life September, Bleeding, Breaks and Burns. I'm going to go over the 3 Bs, which are the basic things that you will come across in the real world. So first of all, we need to start with what is blood, essentially. This is basic school science. So blood is made of 4 different parts. So you've got your red blood cells, which transport oxygen and carbon dioxide. They are kind of donut shaped, so they can squeeze down and fit through blood vessels and things, unless you've got a condition such as sickle cell, where some of them are sickle shaped, they're the wrong shape, so they cause problems. So if you want to go and research sickle cell, then by all means, there are plenty of charity websites with lots of information on sickle cell. Next are white blood cells, which fight any infections that you might kind of come across. They can also cause issues with your own immunity. If your white blood cells, for whatever reason, decide that certain parts of you aren't actually parts of you, they can attack your own body, and you end up with conditions like lupus or alopecia, where your body attacks itself. Otherwise, they're pretty good at fighting infection. They do that from basically the point of your birth, so they're not all good, not all bad. Next, you have platelets, which when exposed to air, they're supposed to bind together and form clots, which form a basis to stop bleeding and help healing. But if they start to do that inside your blood vessels, they can then become what they call a thrombus, which is a floating clot, which then moves through, and when it finds a tight vessel or something, it can block it up and cause heart attacks or strokes and things like that. And then you have plasma, which is essentially the soup that kind of carries everything and lubricates everything, and that contains your hormones, glucose, water, and various other bits and pieces. So that's kind of basic school science. And then a bit more basic school science. Your body has a continual cycle of movement of blood, and you first have your arteries, which take the blood from the heart. They're under a lot of pressure, and they contain really bright red blood because it's full of oxygen, and it will spurt if it's cut, so you can lose a lot of blood from an artery very quickly. And then you've got the veins, which bring blood back from the body. They're not under particular pressure. They rely on the body's movement itself to help the blood move back to the heart. They have valves inside that stop the blood moving backwards. But if your valves are faulty, you end up with varicose veins, where the veins start to swell and not work correctly. They carry very dark deoxygenated blood, and if they're cut, the blood will just flow. It'll kind of steadily flow out. And then when the blood vessels separate down and shrink down and get to the very ends of things and into the tissues, they become capillaries, which are under a little bit of pressure and will ooze blood, but there won't be particularly strong flow. Now, there are a number of ways that you can get yourself injured, essentially. So, and what you need to take into account with injuries is kind of the manner of injury. It's how it happened. So, first of all, you have this character. If you come across this character using a straight edge weapon, you're more likely to get something like an incision, which is a straight, clean cut. It may not necessarily be deep, but it's straight and clean, and therefore can bleed quite a lot. But it's easier to close up and easier to sort out in hospital. And then you've got the other side of that, is if you're cut with something that is jagged and sharp, you'll end up with a laceration, which is a jagged wound. And because you've got lots of torn edges rather than cut, it's more likely to get infection and that kind of thing in there. And then if you're a particularly silly person, you could end up getting an abrasion or a graze. Now, essentially, a graze is when the top layer of skin is just kind of scraped off by some sort of friction. Now, if you just graze your knees, it's not necessarily that serious, but someone like this, or someone who's moving at a fair speed, will get what's called road rash, where essentially the tarmac of the road shears off a layer of skin and also deposits a lot of grit and dirt. So something like that will need very careful cleaning, and is open to infection because there is so much exposed skin. And then if you get kind of a dull blow, a blow that is not sharp, essentially, you'll end up with a contusion or a bruise where you've just got bleeding in the tissues. Now normally that's okay, but if you've got haemophilia or some forms of if you're taking warfarin, blood thinners, or if you've got hepatitis, that can also cause severe bleeding that doesn't stop on its own, so it may need help. If there is a large amount of blood across the stomach, then that could indicate internal bleeding, which really needs looking at. And then we have a puncture injury, which is essentially, they call it a low velocity puncture, and that's because you get a point that goes through without adding any more force, essentially. So a nail or an idiot or something like that. The problem with puncture wounds is you only see the very, very top of it. It could go down very, very deep and do lots of damage on the way down, but you don't see that, you only see the very top. And then you've got a high velocity puncture wound, which is essentially a gunshot wound. And what makes this more dangerous is the way the bullet spins. Because a spinning bullet creates kind of a vortex behind, which when it goes through a body creates more damage. So on here you've got an entrance wound which is quite small, and then the exit wound is larger because of the amount of spin created behind the gunshot. And then you've got, if you're an idiot with an axe, you could end up amputating something. Now the main thing to think about with amputation is, where is it? If you can find the limb, the finger, whatever, then in all likelihood it can be put back. So dress the wound you have, but always look for any parts as much as you can. So particular risk areas you need to think about with bleeding are the face or scalp will bleed a lot because there's lots of blood vessels in the face. Won't necessarily be serious, but looks bad. So look out for damage to the underlying bone. So if you can gently feel around a wound and see if there's any kind of movement or anything like that, any particular tenderness, then you might indicate a break. Danger areas you need to think about are chest, obviously, neck, wrist, inner elbow and inner thigh. Anywhere there is blood vessels that are close to the surface can cause you to damage an artery or something, and then if an artery is cut you can lose most of your blood volume very, very quickly. So, and then with a nosebleed, the treatment these days is to tip your head forward and pinch the soft part of the nose. Try and encourage your casualty to spit and not swallow, because you can make themselves ill by swallowing too much blood. And that's also an easier way of indicating how much blood they're bleeding. With a nosebleed, if it's not cleared up in 15-20 minutes, then you might need to think about getting them to not exactly casualty, but probably a walk-in centre. Unless they're haemophiliac or they're on blood thinners, when they're going to need some extra assistance to get blood bleeding stopped. The general rule with any wound is put nothing in, take nothing out. You do not have the training to do it, so don't try it. So if there is a foreign object, if they've been stabbed or whatever, do not remove the foreign object and do not attempt to go digging around inside a wound. So basically, what do you do with a bleeder? First you grab the bleeder, you take them by whatever limb is bleeding and raise it. So raise the bleeder. Then you lay them down. Obviously if it's a leg wound you're going to do that first before you raise the leg. Then dress the bleeder firmly. If you've got one, keep a dressing in your bag and that comes in handy. If not, then make do with what you can and then get them to hospital. If they're at a point where they need some form of dressing, then they definitely need some form of hospital. So you need to think about gloves. Now, gloves don't necessarily help a situation. Essentially all gloves do is keep you from cross-contaminating. The risk to you personally is only if you also have an open bleeding wound, or if they splash in your eye. So you don't need gloves, but if you can get a couple of pairs of vinyl gloves, not rubber, and put them in your handbag, they come in handy. Excuse the chap next door, he's playing about with his motorbike again. Okay, moving on to burns. There are three main thicknesses of burn. So you've got your superficial sunburn, which is just damage to the surface. It'll be red and sore, but anything bigger than 5 of the casualty's palms. Your palm is around about 5%, so any more than 5 of those need some sort of medical treatment. Most likely it would just need kind of monitoring and that kind of thing rather than anything serious, but anything more than that, then they'll have issues with dehydration, and there could be deeper layers damaged as well. So with superficial burns, do not apply oil. Use oil in cooking because it transmits heat. If you put oil on a sunburn, it keeps the heat in the skin. So with something like a sunburn or superficial burn, cool it down with water, or have a cooling shower, and then use a water-based moisturiser, never oil. Don't use butter or anything like that. Okay, partial thickness burn will have red spots and blisters and a lot of pain because you're just hitting the nerve endings. If the patch of burn is bigger than their palm, they go to hospital. With blisters, never ever ever pop a blister because you can introduce infection and that kind of thing. If there are blisters kind of between fingers and things, they may need popping, but it needs to be done by a professional. And then a full thickness burn is very dangerous. There's a huge risk of infection and dehydration. They will feel very little pain because they've burnt through the burn endings, the nerve endings. That must go to hospital. And any burn on a baby must go to hospital, full stop. If you've got different layers of burn in your patient, then they have to go into hospital. Even if it's mostly superficial, but there's a little bit of partial or full thickness, they still need some level of care, because with burns there's a lot of area of skin that's damaged, and the likelihood of infection and dehydration is very, very high. This day and age we need to talk about acid. If you come across someone who's had something sprayed in their face or sprayed on them, then use water, as much water as you can, to try and wash it off. If at all possible, try and wash it away from any side that's not affected, if that makes sense. Try and wash it over itself rather than onto clean skin, so you're not spreading things around. There are plenty of videos around for the treatment of acid burns. So moving on to breaks. So there are various different types and names of fractures, but there are 4 kind of main types. So you have what they call an oblique, which is where the ends of the bone are broken but they're still together in place, so it's fairly stable. Then you have a comminuted fracture, where there is a break and then there are pieces. There are small pieces of bone that are kind of have blown away from the break, and they can cause damage to blood vessels and other structures. And then you have a spiral, where you've got a force of a twisting force, and that can cause a break to circle round the bone. And then you have a compound fracture, where you've got an end of the bone is actually sticking through the skin. So the compound fracture you treat like a wound, so cover it if you can. Don't try and push the bone back in. Never try and do that. Again, it's don't fiddle with anything that's in a wound. So generally, unless it is clearly broken, unless it's clearly in the wrong position, there is no way of knowing whether or not something is broken. A patient tends to feel very sick, and they would have probably heard a crack. So, if in doubt, they go to hospital. Hospital can clear them quite easily, but if in doubt, send them off. So the particular risk areas for bones are around the skull. So if you think they've had or if they've had a blow to the head of any kind, look out for some fluid in the ear. If you gently feel around the skull, if there's any kind of movement that feels wrong, and that's an indicator of a skull fracture. If they've got any straw coloured fluid in their ear, then that again indicates a skull fracture. If there's any sign of a spinal injury or pelvis injury, if they've fallen from more than 2 foot high, if they've fallen onto their head, onto their backside, if they're sat down hard, then that could indicate spinal injury. So get them laying flat if you can, if not, support them where they are, and assume the worst. Paramedics always assume the worst. They'll put you on a backboard with neck blocks and a collar, just in case. Better to be overcautious than to miss it and then you have issues down the line. So any signs of kind of tingling in the feet or the hands, anything like that, assume it's a spinal injury. And then circulation. If you've got a break in the elbow or the wrist and their fingers are becoming cold or dusky, where it's kind of grey, then the circulation is in danger. It's not the circulation is being blocked by the break. Then you need to call your ambulance control and let them know that, and they'll bring you up in severity, so you'll get hopefully an ambulance quicker. So that is the basic 3 Bs, bleeding, breaks and burns, and I'll see you again